And okay, looks like we've got no one left in the waiting room.
Okay, so we might make a start. So, hello everybody, my name's Craig Hodges. I'm the Director of Orygen Global, and I'd like to welcome you all to our Youth Mental Health in Action session. For those of you joining us from Eastern Europe and Central Asia, a really warm welcome to you today. And there we go, welcome in many different languages, and I guess the different languages and countries that are joining, whether it's this morning, this afternoon, or this evening here in Australia. So you're very warm welcome to you all. Before we commence, I'd just like to begin by something we do here in Australia is acknowledging our First Nations people and the land that we meet on today. So I would like to acknowledge the Wurundjeri people of the Kulin Nation, who are the traditional custodians of the land on which I'm presenting from today, and pay respect to their elders past and present. I recognise and respect their cultural heritage, beliefs, and relationships with their ancestral lands, which continue to be important to the First Nations people living today. So just a few housekeeping items. So if we could have people have their mics off during the presentations. And also, if you have any questions during the presentation or during the Q&A session, if you could place the questions in the chat function during the presentation, that would be great. Also, if you use the raise your hand symbol that we have for questions or comments during the Q&A session, or similarly use the chat function where you can place a question as well. We will be recording this webinar, and also we'll be recording the breakout sessions. So there will be an opportunity for people who may not be able to be here for the full 2 hours, or who have colleagues that would like to have joined but weren't able to, they'll be able to view it at a later date. So again, thanks everyone for joining us, and also I'd like to also acknowledge our partners in UNICEF, who we've been working together to put this together. So again, thanks to Nina and Ruslan, who we've been working with on putting together this presentation this evening. So I'll just go through briefly the session today and what we're looking to cover off on. So I'm going to hand over in a moment to give to Peter Varnum, who's part of Orygen Global team, and also Nina and Ruslan from UNICEF, who I'm sure many of you know, who'll provide a bit more of a background and context to today's session. Ironically, this was supposed to happen about 2 years ago, but then a thing called COVID got in the way. So look, we finally got there in the end, so it's great that everyone is able to make it. Then we're going to hand over to our colleagues Anne-Marie and Kira from Headspace. Headspace is Australia's National Youth Mental Health Foundation, and we have and they'll explain the Headspace network that's been established around Australia, and they'll provide a presentation on the Headspace model and how that's been established here in Australia. There'll also be an opportunity for Q&A after their presentation. And then we want to, I guess, involve as many participants as possible in a bit of a discussion and hear from you about youth mental health in the different contexts and countries that you're joining in from today. I think we've got about 13 or 14 different countries represented today, which is absolutely fantastic, because it clearly demonstrates that youth mental health is a significant topic for most countries at the moment, and particularly, I guess, it's been heightened by the global pandemic. Then we're going to move on to just a facilitated discussion with our people here at Orygen Global. If you've got more questions in relation to sort of youth mental health programs, you know, establishing youth mental health programs, what are some of the fundamentals? So again, it's going to be a fairly open forum where we can have opportunity for those. And then we're going to conclude by going into breakout groups for 20 minutes, and we've got 3 areas of focus there, and you've all been assigned different breakout groups. So the first one is youth engagement in youth mental health service system development. The second is youth mental health community-based services and interventions, including the global framework that was developed by Orygen. And then the final one is the role of digital technologies and how they integrate with in-person activities. And each of those groups will be facilitated by someone from Orygen Global. And then we'll come back to the larger room and have an opportunity just to wrap up before we finish our session at 8 p.m. Australian time, which I think is 12 o'clock Central European time. So thanks, everybody. I'm going to now hand over to Nina and Ruslan and Peter to give a bit more of a context to the session today.
All right, so do you want, Peter, why don't you go first?
I'll go first and hand it to you. Thanks, Nina. Great. Thank you, Craig, and welcome everybody. It's really great to see all of you. I'm Peter Varnum. I'm the Associate Director here at Orygen Global. I am based actually in Norway, so similar time frame to all of you. And the hope for being based here was that I could foster some of the relationships that we have with folks in this sort of time zone, which of course has been made more difficult by COVID, but still nice to be on the same time zone. Just to echo what Craig said, I think it's a testament to the importance of youth mental health, and the fact that you're all here is very encouraging in terms of how we can help support your efforts in youth mental health in your own context. And we're looking forward to hearing more about those contexts today. Just in case you haven't had an understanding or haven't heard of Orygen too much, just a very brief sort of primer on who Orygen is. So Orygen is based in Melbourne, Australia, and has traditionally been Australia's Centre for Youth Mental Health, Centre of Excellence for Youth Mental Health. And the concept for Orygen started almost 30 years ago, and the organization has certainly evolved over that time. Started in research and psychiatry that was based in early psychosis, and then has morphed into more broadly sort of early intervention and prevention for youth mental health. And Orygen is, very much believes that this period of adolescence, when young people are making a transition from either schooling into the workforce or into more schooling, that period it can be a very precarious position and has ripple effects for young people as they continue through their lives, which affect, of course, them as individuals, but also the broader societies and economies as a whole. So this period that we're focused on, these young people from the ages of 12 to 24, and even older in some cases, it's a really, really critical period for supporting young people. And we certainly believe that mental health is something that shouldn't be just tackled by specialists and psychiatrists and psychologists, but definitely something that should be tackled at the community level and have that focus on prevention. So you're going to hear a little bit more about how we've done that. You'll hear from Headspace about how that's happened in Australia. You'll hear about this global framework that we've developed, which includes principles to follow when you're creating youth mental health service models. But before we get there, I also just want to acknowledge certainly the great relationship and partnership that we have with UNICEF, and thank Nina and Ruslan for helping to set up this meeting and the collaboration that we've had over the last couple of years. And you'll hear this again at the end, but just to say now, what we're hoping is that this webinar and the conversations that we have today basically do two things. One is continue this sort of process of conversations and dialogue on youth mental health that you'll have heard from Nina and Ruslan and others that fit in with the UNICEF priority area, with the Helping Adolescents Thrive toolkit, with a lot of the work that WHO as well is doing. We're certainly plugged into all that and want to be collaborators in that effort. And then the second thing is, one of the things that Orygen Global is doing programmatically, is partnering with different organizations around the world to try to help them bolster their youth mental health services or advocacy efforts. And so as you hear more about the work that we've done in Australia and what we're doing around the world, we're very interested to continue this conversation after today and to use this as a sort of jumping off point for new partnerships in the region. And hopefully when we can start traveling again, we'll be able to meet each other face to face. But in the meantime, there's a lot that we can do over the internet. So very much looking forward to keeping the conversation going, and I'm really happy to meet all of you. Thanks again for joining. Over to you, Nina and Ruslan.
Thank you. Thank you so much, Peter. Thank you, Craig. I think it's great that we're having this chance to talk about youth mental health. I think that for UNICEF, this for the regional office for sure, but for all of our country offices, the issue of mental health has been on the agenda for many, many years, in the sense that much of the work, many of the activities we do have a direct effect on youth and well-being, on child well-being, on parenting, on young people's health, etc. However, what I can see is that with COVID in particular, the emphasis on adolescent and youth mental health has really increased. And the number of governments and organizations, youth organizations, parents organizations, and partners in countries are increasingly asking for support on developing much more effective, efficient, relevant youth mental health programs. So we are delighted to partner with Orygen. I think that certainly our friendship goes back to the times of the Leading Minds conference, where UNICEF was the first time that UNICEF talked about the topic of youth mental health under the leadership of both our executive director, ED4, as well as the director of WHO Euro, Dr. Tedros. So it was really an opportunity to really launch this. And then COVID came, and of course, the demands are there. There's a lot of interest in the topic, but there is much less examples of how does it really work. What does it take to get it going? What does it take to put mental health on the agenda? Who needs to be involved? What are the policies? What are the processes? How to involve young people in the processes? So these are some of the examples where we thought that the experience Orygen has had over years. You're the gold standard, you're the Cadillac, the Porsche, whatever you want to call it. So we're really happy to have a chance to learn from the best of the best, knowing full well that it will take us a lot of effort and adjustment and creativity to be able to adapt some of the elements of your model to the work that we're doing in countries. So we're really grateful to Orygen for giving us your time, your expertise, sharing this with us. We can learn a lot. And and all I can say is that from the regional office perspective of UNICEF, we're really working towards improving youth mental health, doing our best, working with country teams, country partners, governments, non-government organizations, and young people. And it's a special pleasure for me today to also mention that in this call, we have representatives of our youth network, our youth advisory group, that is helping us shape the policies and the processes and what the region should be doing as a priority in youth mental health in the region. So a special welcome to all of you. Thank you for joining, and an even more special welcome to those young people who are in the room and who are helping us shape the how this should look like in the UNICEF country offices and in the country in the region that we're working in. So thanks again. Looking forward to a useful and interesting seminar. Over to you, Ruslan.
Thank you, Nina. I think you covered pretty much all. I just want to add that it's not the first time where we are applying for the expertise in rolling out the interventions for youth health. So 20 years ago, we rolled out the youth-friendly health services, and then we had very important and very successful partnership with the Swedish network of youth-friendly health services. So learning from them how they do it. And as a result, we had a number of centers which will be established in Eastern Europe, Central Asia on the youth-friendly health services. We're still working. So at that time, main focus was reproductive health. Today, we see how mental health become much more important than ever. And I think this partnership with Orygen, which help us to replicate some of the best practice and experience that we're doing in Australia and across Europe and other countries. So I'm looking forward to this section and learn from you. And think about the way forward together with you. Over.
Great. Thank you, Ruslan and Nina. And so we're going to get right into it. I've just put a little message in the chat. It's great to see there's, I think, 50 or so, almost 50 people here. If you want to introduce yourself in the chat, please go ahead and do so, where you're calling in from and who you're with. And as we're doing that, we're going to get into the meat of things here. So we'll turn now to our colleagues from Headspace in Australia, Anne-Marie McCabe and Kira Mansfield. And I'll leave you both to introduce yourself and over to you for your presentation.
Great, thank you, Peter, Nina and Ruslan. That was a great intro, and really delighted on behalf of Anne-Marie, myself and the rest of Headspace, an honour and a privilege to be able to meet you all tonight and to start the conversation and take you on a little journey in terms of how we developed a youth mental health service here in Australia. I'll spend the first few minutes talking about the history of it, and Marie will take you through the model, and then we'll obviously do some questions and answers at the end. My role here at Headspace National is Head of Centre Services. I've been with the Headspace family since 2010 in a variety of operational roles. My current role really is to see the expansion and implementation of Headspace services across Australia. And that means, making sure that the facilities are fit for purpose, that young people are at the centre of everything that we do, and then ensuring that the services, once they're established and implemented, are actually run to fidelity to make sure that we get that consistency across a national model, but implemented at a local level. Anne-Marie, do you want to introduce yourself?
Yeah, thanks, Kira. Hi, everyone. It's certainly a pleasure to be here tonight, and thanks to Craig and Peter, Nina and Ruslan for making this opportunity possible to talk about Headspace and the model here in Australia. I should say what I do here. So I am the Manager of Business and Service Development. I've been with Headspace now for 7 years. I get involved when there's interest, often from globally. We're always, happy to talk about the Headspace model and what we're doing here in Australia, and really welcome the opportunity to share our experience. So I'm just going to move through the slides, and hopefully you're seeing all the slides at the moment. I'll just take the time, as Craig did earlier, to acknowledge our First Nations people. Tonight I'm sitting on the lands of the Wurundjeri people of the Kulin Nation. I am in Melbourne, down here in Australia, and I would like to pay my respect to the elders of these great lands. Now let me just click through. So what we're looking to just cover today is a quick background on Headspace. We'll talk a little bit about the history, the evolution. We've been going 15 years. We'll talk a little bit on participation and the importance of that. And Nina gave a shout out earlier to the youth advisory group that are attending the call tonight. So it's wonderful that you're here joining in this discussion. We'll also talk a little bit about the evidence base, our role in awareness and advocacy, and then Kira is going to get into a lot of detail really about the Headspace Centres and what those youth mental health hubs look like in Australia. There is a lot of slides. I'm not going to talk to all the detail, but I just wanted to have some snapshots in there so you kind of get that kind of flavour overview of what we do here at Headspace National. So just quickly, our vision is very much for all young Australians to be supported to be mentally healthy and engaged in their communities. For us, impact, it really looks like that young people can access the right support when they need it and how they want it. And I'm just going to go to a lovely little visual here, and that just talks through some of the aims of how we're fulfilling on that vision and that impact. Our 4 core streams along here that are very important to us: mental health, alcohol and other drugs, work and study, physical and sexual health, and then the mediums that we use to try and support young people and their families, whether that be in person at our Headspace Centres around the country, or digitally online for our website, our online service, our work and study service. So that's just, I'll move on. I'm just going to hand to Kira now, who's going to talk a little bit more about the history, about how we got started, and a little bit about the support.
Thanks, Anne-Marie. So Nina, one of the things you mentioned in your introduction, I think, was, you know, this doesn't happen overnight. It does take a lot of hard work, and there are years of, you know, experience and funding and great relationships that have been built over the time. So Headspace was originally, you know, a concept back in 2006, and you can see, I'm not going to go through each of the years, but basically what the next two slides speak to are the expansion of the Headspace network, the other service offerings that need to grow and evolve as the model evolves over time. It also will show you how we, I guess, systematically with funding and negotiation over those years built a central network up and built the brand awareness and to become a trusted brand over time. I think it's fair to say, and the young people on the conversation tonight will say that, you know, one thing that resonates with young people and families in Australia is knowing that there is a Headspace service. They're aware of what it stands for, what it means, and that it's a trusted service and place for them to go when they need to seek help. And the evolution of the model and the complementary services that are needed to support a national network and a diverse population have been something that we have worked on with our partners, with Orygen and obviously various other organizations, you know, since 26. So at Headspace National, we started the Headspace program back in 2006, and we were the commissioners of that until 2015. And by that, I mean, we did everything, including procuring the services and implementing them, and then, I guess, making sure that they delivered a safe and effective service. And then from 2016 onwards, there was a reform, a mental health reform that happened here in Australia. So basically, they looked at, you know, should the same organization be, you know, commissioning a service, being the peak body of it, and, you know, overseeing it from every aspect. And the decision was made to devolve the commissioning out to a different source, and they happen to be called primary health networks here in Australia. But basically what that means is that the role of Headspace National changed. And effectively now what we do is support the network and the commissioners to still deliver the model, implement it, and then obviously ensure that it is delivered to fidelity. The next slide will give you a sense of, it's a very busy space that we work in, and you'll see it's a very complex governance structure when you look at the funding flows down from a Commonwealth Department of Health here in Australia. It goes to a commissioning body.
Sorry, I'm just going to click through.
That's okay.
I moved the order. I'm sorry, Kira. Here we go.
That's all right. It moves through to primary health networks. It then flows down to lead agencies that you know, are the funders, are the person that run the services day to day. And this is where that local context, local community, it's built, run and owned by local community, the young people that live there and their family and friends. So I think that's where it's really important that you maintain that sort of local structure, and then the oversight by a national organization. And I think the beauty of this structure is that, and the way that it's been sustained is through the building of those relationships and maintaining that solid support over the years since 2006. Happy to go to the next slide, Annie.
I'll just go back to, where are we?
I think it's over to you for young people, family and friends participation.
Great, thanks, Kira. So I guess, as Nina said, for Headspace, participation, and particularly youth participation, is all that we do, live and breathe. It is so important to have that youth voice, family and friends voice, and everything that we do here at Headspace. As the slide says there, it is the foundation on which Headspace services exist. This picture here is actually our National Youth Reference Group from not the one now because they've just changed, but from earlier. So it's a fantastic group of 24 young people from across Australia, from diverse backgrounds. Many of them have been on their local Headspace Centre youth reference group. they come, they form, they are our national reference group, and pretty much get involved in a lot of our new initiatives, projects, resourcing, and everything that we do. Participation for us works on I guess a participation spectrum that is very much about informing, consulting, involving, collaborating, sharing, empowering, and enabling. So whenever we involve young people and or family and friends, we look to this spectrum to see at which kind of point we would engage people. I'll just move across there. We have many different groups. We have our key group down here on the left, the Headspace Youth National Reference Group. So that's that group of young people, the 24. We have our Family and Friends Reference Group. We were lucky 2 years ago, we had our first inaugural board youth advisors. So they're 2 young people that sit on the Headspace board, and that has really enriched, I think, the board for Headspace. And we have other various ways that we can get participation in our programs, whether that be through internships, when we're doing campaigns, when we have reference groups, and also another nationally led group called the Australian Youth Advocates, which is made up of many youth mental health organisations across Australia that come together in a reference group that Headspace oversees and supports. I just want to go through quickly a little bit, I guess, of the evidence. Everything we do here at Headspace is evidence-based. We're always looking for best practice, and we're always looking to evaluate our services. Carol might talk a little bit more to the Headspace model when she gets to Headspace Centres, but I guess at the core, the Headspace Centre model is 16 components, Kira, still? Fantastic. In the centre there, the 4 core streams, central to what we do. We have, again, central to what we do, our drivers, our young people and family and friends. We have our enabling components and our core components, but I will let Kira talk more to that when we get to centre services. I'll just flip through to the next one. Building, I guess, the evidence base and ensuring everything we do is clinically safe is led by our clinical practice division. There is very much a focus on building a platform that equips the Headspace network with knowledge, skills and tools to continuously improve the quality of young persons' experiences. We do that through many mediums. We're developing and embedding frameworks and tools, and that's really around clinical governance, quality and risk systems, many of the practice principles that we put out, and a lot of the resources some of you may already seen on the Headspace website that we make available. Evaluation and research is also critically important. We want to ensure that every service and program we do is underpinned by the best quality evidence, and that they are effectively meeting the needs of young people and families. So we have a very large strategy, impact and policy division who work on evaluating our programs, and that's within the centre network, and that's backed up by a very rich national minimum data set, which basically collects information on the young people that access our services, and also gathers information from the service provider that provides those services. And that really helps us inform the types of services we're delivering, who's coming to Headspace, why they're coming to Headspace, and really kind of helps enrich that whole evaluation process of improving and learning. And we also have a small sort of a research team who work on projects, various projects that come along, and publications. Awareness and advocacy is another important role for Headspace National, and very much about raising awareness of mental health, breaking down the stigma. And we do that a lot. And I think it might have been touched on earlier by Kira, talking about the Headspace brand. The power of the brand is immense in what we do, because we want that consistent kind of consistent brand to what we do, so that where anyone, a young person anywhere in Australia can recognize the Headspace brand or logo, and walk into that service and know that they can get a consistent service that we deliver across the nation. So campaigns and engagement activity is very big. We have a number of different ways that we get the messages out about Headspace. We have a National Headspace Day. We deliver content on social media. We have numerous events, not so many face-to-face these days. We used to have, turn up at a lot of youth, where youth would be gathered, and that might be at music festivals and the like. Obviously, in these COVID times, we haven't been able to get out there, but we're trying to find other creative ways to do that. And a lot of our campaign work, and I'll just quickly move through. That's just one of our campaigns, and that was very much about trying to engage young men. Young men are one of our hard to reach groups here in Australia. I also just wanted to reflect a little bit on our Aboriginal and Torres Strait Islander cultural practice and engagement. It's very important for us that we are advocating for the needs of our First Nation young people, and we are reaching them in a culturally safe way. So we have many initiatives that we're doing in terms of reaching that group, and most recently is a cultural review of the Headspace model. I am going to now hand back to Kira, who's going to get more into depth about Headspace Centres and what it is we do there.
Thanks, Anne-Marie, and we're nearly finished, guys, so we won't be keeping you on for too much longer. But I think it's fair to say that Anne-Marie spoke earlier to the range of digital services, I guess, that are available to young people to ensure that they have choice and a medium to deliver and to receive their mental health service. But I think our experience here is that the majority of young people actually prefer face-to-face engagement, and to facilitate receiving those mental health services in a face-to-face environment, we've created a national network of centres. So effectively, this is just a snapshot of what some of the interior and exterior of those services can look like. It's really important. Young people, family and friends tell us that it's important that the service is inviting, it feels safe, and it's welcoming. So they're sort of the key principles in terms of how these centres are established. In terms of the actual Headspace Centres themselves, so these centres are actually run by local mental health organisations. And those organisations will follow a set of guidelines that are produced to make sure that they deliver that consistent quality of care, and that there's that sort of look and feel that is recognisable to community. All of the services and all of the organisations, to get themselves established and to get the service up and running, receive a core base funding, if you like, from our government to set them up and to fit them out, and then ongoing recurrent funding to deliver the base sort of model. And then some of them, depending on the size and the location, if you're in a metro site, you've got access to a much broader network of health professionals than you would in rural and remote areas. So they do vary considerably in size and in terms of the offerings. But one thing that they do all have to do is to be certified. So we want to make sure that, yes, we have a national network. It's growing to currently sitting at 139 of these centre networks, that centres that we've just showed you. But we do want to make sure that they are all certified, that they deliver evidence-informed interventions, that the care that they deliver is appropriate. We want to make sure that the service, even though it is locally tailored, if you like, that it is well integrated into all of the other services that go towards supporting a young person in that region. I mean, Headspace is just, sorry, Annie, if you could go to the other slide that talks to Headspace Centres, that would be great, thank you. It's important that these centres actually do deliver to the young people, but you know, they're not everything to everyone. So it's important when the on that continuum of care, and when those young persons' needs change, that they have built relationships with other organisations in their local community to be able to step up and step down a young person and have that continuity of care and appropriate care at a time that meets the needs of that young person and their family. And I think we also, throughout the certification process, ensure that young people and their family and friends continue to inform how the service is delivered in their local region, and obviously that the evidence-based interventions being delivered are contemporary and appropriate as the model evolves over time. One of the things we're very lucky to be able to offer the young people here in Australia is obviously the visits are free, because it is funded by the Commonwealth Government. And as we said, it is created by young people for young people and operated by local community organisations. So I think that's basically where I wanted to leave it. And we're happy, I think, now to take any questions and answers that any of you might have, or to go back and clarify any points of interest that you might have.
Great, thanks, Kira. Thanks, Anne-Marie. You're indeed right. We do have about 10 minutes for questions and answers. So if you do have a question, feel free to just put your hand up, or if you'd like, you can just take yourself off mute and ask your question. Maybe I will kick off the Q&A discussion. I just wanted to see if you guys could get into a little bit more detail on, and Stanislava, I see your question. So maybe we'll go to you first and then I'll ask mine afterwards. So please go ahead, Danny.
Thanks a lot. It is a wonderful opportunity, as I wrote in the chat. I just wanted to try to figure out how you have managed to also have another topics which will traditionally belong to other sectors, education or employability, and it is all funded through the, let's say, public health domain or government approach. So it's a big thing here to connect all the ministries and do something intersectorial within the governance of one ministry of, yeah, I think it is clear, my question. Thank you.
I'm happy to just give you a quick snapshot of how we make it work in this context. Is a consortium of partners, basically. So effectively, we fund an organisation to establish the service. They build a local relationship with an alcohol and drug organisation, with a vocational educational service provider, you know, with the GP practice, primary care sort of practice, if you like, and the job of the lead agency, who's the organisation that's been given the opportunity to establish a Headspace Centre, is to demonstrate how they can bring all of those organisations together to work under the one umbrella of a Headspace Centre. So they make space available, they make time available, and what we do at Headspace National then is orientate all of those other organisations to become youth friendly, make sure that they sort of adhere to the key principles of delivering a youth friendly mental health service, understanding that there are many factors that, you know, intersect with a young person at any given time in their journey. So really all of that work is done at a local level by local communities, bringing in those other organisations to deliver some of those other key vocational education supports through a consortia of partners. It can be anything from 4 or 5 different organisations up to 20 sometimes depending on the breadth and depth of the local service providers. And I think the key relationship here is obviously with your tertiary mental health service, because Headspace is a primary care, it's delivered in primary care, it's a primary care service. And obviously when a young person becomes acutely unwell, it's important that you're able to step them up to and into those other service provisions through that consortium model.
Great, thanks, Kira. Let's go Milika, and then Dilian, and then Ruslan.
Hi, hello. Hi, my name is Dr. Milica Pevic-Milovančević. I'm child psychiatrist from Belgrade, Serbia. And thank you very much. I'm one of the fans of your Headspace, and we have like a year ago, we presented the work that you were, we were just talking about how we can get in touch with you. So thank you, UNICEF, and thank you all, guys. I have you just respond on my main question. So this is kind of primary health care. So within the primary health care, you have the system. So that was my main question. And the other thing is, what was like the main challenges that you are facing right now? Like, I have a question about confidentiality issue. You know how adolescents are very take care about that. Then I have a question about funding. And so what was like the main challenges, and like if we want to start something similar, like what would be the key messages for us? Thank you very much. It was very helpful and very nice.
You're very kind, and thank you. I think the key challenges, I might start with, if you're getting this started, what do you need? I think you need support from your local government or from philanthropy or whoever it might be to secure funding to get a base sort of service off the ground. And you need to kind of set clear guidelines and parameters in terms of what your expectations are and where and who your audience is. So Headspace was, developed to be a brief intervention and early intervention service in the primary care setting. So we're not saying that we are everything to every young person in Australia. We're very much about, sticking into our swimming lane and understanding, where we fit in the overall service sector. So I think it's important to think about, when you're establishing a service, what those parameters might look like. In terms of the challenges, so what comes with developing a national brand and becoming very well known is that every community thinks that you are there for everyone, and that you can meet every young person that presents with any issue or any diagnosis at any given time. And so the challenges we find now is that there's a huge demand, particularly with COVID. I'm sure you'll spend a lot of time talking about the impacts of COVID on young people. We know what that looks like. Which now means it's put a huge pressure back on to the service offerings and those centres that are delivering that service find themselves in an unusual situation that they've got high demand. Young people are presenting with much more complex issues because of COVID. So the length of time that's spent with every young person on an intervention takes longer. So they're actually seeing less young people as a result. And workforce, that we've had our borders closed here in Australia since, March 2020, I think, which means we don't have that influx of workforce that we need. And it is a challenge. So we've got burnout, we've got high demand, and we've got reduced capacity. So there's some of the challenges that we're facing, and an increasingly higher level of complexity that's presenting to the service on a daily and weekly basis. And if your next question is how are we going to deal with that, and we keep advocating and working alongside our partners with Orygen and other services, we keep advocating for more funding. And the workforce issue, obviously, we have to have a longer term strategy that we're working on to address those needs as well.
Thanks, Kira. Let's go, Dilian. Sorry, Ruslan, I'm going to push you back because Mila, who is one of the youth advisors, has a question. So let's go Dilian first, then Mila, and then Ruslan to you.
Thank you very much. My name is Dilian Manolov. I'm working with the Bulgarian office of UNICEF and also with the HQ of UNICEF. So I have a question around the distant helping. So let's call it like this. I heard you saying that the youth are more towards in-person communication or intervention. Can you elaborate a bit more about it, and how we can gauge where the youth is aiming more towards in-person or more towards internet-based interventions? And the next question that I have is how you're choosing actually your staffing. Are you aiming more at more experienced people who are giving this type of early intervention, or you are aiming at younger people, or you are staffing in different principles? Thank you very much.
No problem, Gillian. Annie, I'm happy to answer the start of this, and I'll hand over to you for the data piece. In terms of the staffing profile, I think it's fair to say it's a mixture of all of the things that you just said. A typical staffing profile will have an experienced clinical lead who is credentialed and will have many years of experience in working in youth mental health, or in mental health more broadly. And then we can obviously, induct them into what it means to work in Headspace and work with young people. So experience at that clinical governance level is really important. And then you can have a variety of roles and ages and responsibilities underneath that. I think the age of the clinician isn't so much a barrier for us. It's more about their appetite to work with young people and their ability to be able to connect and engage with young people. That's the most important thing we find, certainly in the face-to-face service delivery, Gillian. The second piece then would be in relation to the face-to-face versus the digital. I mean, we're lucky that we have a database. We've developed a minimum data set where we collect a lot of information from young people about their experience of the service, but also their preference. And so we can see that I would have thought, being an older person, I would have thought that young people would love digital mental health services. And, when I was in another role recently commissioning services, I was really pushing for online digital platforms, and the uptake of it was nowhere near as high as I had anticipated, even though our sort of research, if you like, and our co-design had told us that it would be. Interestingly, in COVID, we have no alternative right now in Australia but to move the majority of our services to telehealth, so non-face-to-face, depending on what state and territory you happen to be in. And what we find is that the uptake of services reduces. So there are less people less people booking in, and they're cancelling their appointments because they want to wait until there's a face-to-face appointment available. And then when we interview young people and ask them why, they just say it's because they prefer that engagement. They feel safer walking into a centre, and that just seems to be what works for young people here. And Marie, did you want to, from your perspective, add anything around that data side of things?
Well, I guess just in terms of the number of young people and services delivered, because we have such a larger national footprint of Headspace Centres across the country, the volume of young people are coming through the centre network. That's where the majority of services are. On our online mediums, we're finding that young people engage more. We offer chat, we offer telephone, we offer video conferencing, but we do find when they come in digitally online, the young people are very happy just to chat. That's what they prefer rather than a telephone call. The data does skew towards for gender towards female. There's sort of a high percentage of female. I can provide to Peter and Craig an infographic which could be sent around after this meeting. We'll just give you some key stats on the young people that are coming and the volume of services we're seeing. We've done a lot of work over the years with our digital offering and to kind of as we talked earlier about that choice, to open up choice for young people to get what they need at that time. So they can come on to the digital platform, they can create a Headspace account. From there, they can get access to all sorts of resources that they may be interested. They can bring them into their account and they can have their own little personal space. They can also engage in group online communities, online group work, and then if they choose to, they can choose to go on to have that kind of engagement within a clinician online. But predominantly we see them wanting to use the chat medium to engage when it's online. I hope that answered the question.
Great. Thanks, Anne-Marie. Thanks, Kira. Mila, over to you.
Thank you. My question is not really that complex as previous were, but as we were talking about in our mental health youth advisory group about importance of media and social media, you were mentioning that about youth advisors and then people who are your advocates. So I'm just thinking, not really who are they, because I'm probably not familiar with them, but how do you choose them? And then do you even choose your advocates, or is it, I don't know, maybe celebrities or somebody who is sharing your platform to youngsters, or is it something else? Yeah, thank you. That's my question.
Great question, Mila. And I think it's a bit of all of the things that you just said. So at a centre level, every centre has its own youth reference group, and they inform how the service is designed and implemented and run at a local level. At Headspace National, we have a national reference group. So a group of young people that come together, they get selected through a sort of an expression of interest process, if you like. And they sign up for, I think it's 2 years, Anne-Marie, but Anne-Marie will correct me for how long?
2 years.
2 years. And so they, they become part of the Headspace National Youth Reference Group, where they get to sit on our board, they get to sit on our clinical governance working group, and they get to inform a lot of the campaigns that we run, and a variety of other things. So they're sort of the levels of youth participation, if you like. And then we do have a raft of what we would call Headspace champions, our partners, that could be celebrities. So for example, young people, AFL players, that's our Australian Federation Football. I don't know what it is, actually, I'm not Australian, but they're going to kill me. But we've got this soccer football thing that goes on here. And look, obviously young people really resonate with celebrities that play in sports. So every now and then we will have a champion that will do a particular campaign for us. Some of them actually work with young people locally at a centre. So it's a bit of a mix of everything, Mila.
Great, thanks. And final question here before we move to our next section. Over to you, Ruslan. Thanks for your patience.
Thank you, Peter. My question is that the Headspace Centers, they position themselves as the centers welcome to young people. So we're open to you, so we're ready to help. We are always for you. So, and at the same time, so I think that still, Headspace Centers, so it's kind of a standalone service funded by Australian government as a complementary to existing national health system. My question is, to what extent it is linked with existing system? And if not yet, so do you make any effort to become part of the system rather than being kind of outsourced standalone service? My question is, very closely linked with our work in terms of rolling out youth-friendly health services. Those youth-friendly services which being integrated with existing health system, they prove to be much more sustainable than those that were standalone. So, because let's think about if tomorrow we decide to open Headspace Centers or something like Headspace Centers in our region. So what it should be? So it should be kind of a separate building, separate office, or it should be part of existing system with education system or healthcare system. So it would be great if you can tell us about your experience, because I think it's a big debate there. And my second question is about, we know also that young people really prefer, so that, at least in our region, we can quite often see they prefer, so when they see professionals which are not much older than they are. So, and also, for example, from online counseling services, we see even that they even prefer to talk not to psychologist professionals, but actually to peer counselors. And to what extent you actually involve this resource, you know, in your work? Over.
That's a big question, Rosalind. So I will do my best to answer it in part. I think the first bit is, the first question really is about whether or not you should have an integrated youth mental health service or a service that is a standalone Headspace Centre, for want of another word. Our experience is that in Australia, and we're lucky to have the funding to be able to do it, so I'll preface it by saying that, is that where it is a standalone centre, we have better experience result. The survey results tell us that young people prefer a service that they feel is predominantly designed and made and implemented for them, so that their experience of the service that they receive seems to be have a better outcome for them when it's a standalone service. And by that I mean the actual facility itself is Headspace, but the beauty of it is that underneath that structure, you still have all of your consortium partners. You still have all the other service elements from local providers that come together under a roof. So it's not that it just delivers mental health on its own and you have to go somewhere else to get all the other things. It's all delivered under the one sort of umbrella of Headspace, if you like. That model seems to be the one that works best here. We have established some Headspace centres that have been integrated from the very, very beginning with other, within the broader sort of service sector, if you like. And what tends to happen is that young people's experience is that when they turn up, they're not sure where they're going to go. They feel that it's a barrier to access for them, because their experience is, and this is what they tell us, that they don't feel like it's as approachable or as welcoming as a standalone Headspace Centre. They're not sure what they're going to get when they walk through the door. They're not sure where they're going to go. And even though they might come with the intention of going to Headspace, depending on what the triage or the intake system looks like, they could end up actually being diverted somewhere else. So that just seems to be sort of the feedback. And then the third type of model, I think, is where you've got a Headspace service that's in a standalone building, for want of a better word, but it co-locates a lot of other services with it. But the primary tenant, if you like, is still Headspace. But there are other actual smaller, you know, different organizations that actually physically located alongside it and within it. So I think, you know, my preference is that it is standalone with consortia. I think then young people say, if it's primary Headspace and you've got other services, that's okay, but not when Headspace is not the lead tenant and it's one of multiple services in a big, say, hospital network setting, or in an alcohol and drug environment, or if it's set in a service sector that's across the lifespan, then it kind of, it's not a youth sort of friendly environment for them. It's something that's there for everyone and they don't feel like it's theirs and they don't own it. So they will still engage with it. They will still actually turn up for service delivery, but their experience of it might not be quite what you want it to be. That just tends to be our experience here. I'm sorry, I can't remember. There was another part to your question. I didn't write it down.
The second question is about use of peer counselors, people who are same age as those young people who go for services.
Very important. Very important, and it is a growing part of the service sector here in Australia. I think it sort of comes and goes. I think years ago we had a lot of peer workers in the Headspace network. Then we didn't have a lot of peer workers, and now certainly that seems to be coming back and understood to be fundamentally a part of delivering the service. So I think it's something that we are growing that base. There's a new sort of peer workforce guidelines that have been developed, and then services now are starting to implement that and grow their peer support and their peer network across the services that are already established. So totally agree, and I believe that they absolutely should be peer workers in every Headspace service.
Thank you. Just to summarize, I'll just clarify still for myself, because if we think about like a client-centered approach, you know, so where our young people would be as a center, so we better advise to build service which is standalone, because it's much more welcome and much more accepted by young people. And actually we see it from some other countries too. So their preference would be not go to health center, but go to some standalone center where they will not feel as a patient, but they will really see as someone who welcomes and get in the service, right?
Yeah, correct.
Thank you. Thank you.
Great. Okay, we do need to move on. Nina, do you have one final point before we move on to this next section?
No, I think that it would be useful that when we talk about the next section to cover 2 points. One is the whole certification process, because that seems to be, you know, essential for quality. I think if you can cover that somehow. And the second issue is if you can also mention your involvement in trying to replicate what you've done in Headspace in Australia in some of the other countries where you have worked. And so that would be useful to put things in context. So that's all. Yeah. That's my whole comment. Over. Thanks.
Yeah, I think maybe what we'll do is turn to you guys, Kira and Anne-Marie, for the first part of the question, and then Craig and I can speak a little bit toward the replication and some of the stuff that's happened elsewhere.
So the first part of the conversation was about the certification and the quality. So we have developed a Headspace model integrity framework, and basically what that does is it lets the services know that if you are certified to deliver a Headspace service, these are our expectations. There are 16 sort of core components. So there are the 4 that we spoke about earlier, and then there's lots of enabling components to support the delivery of the service. So it's to ensure that you do have a consortia, you do have a youth reference group, you do have credentialed mental health workforce, you do have workforce that can deliver all of the core streams, that you have a GP and primary care, partnerships at a local level, all of the things that we talked about earlier. So the certification framework, if you like, is a desktop audit where the services have to provide a range of evidence to us to demonstrate that they've got good, solid clinical practice, clinical governance frameworks in use and in practice. They have to provide evidence of the types of interventions that they deliver. That has to be backed up and is cross-referenced against the data set that we spoke to earlier. There's, you know, data thresholds that have to be maintained in terms of outputs and outcomes, but also in terms of young people's participation and their satisfaction with the service. So that's sort of broadly what the certification of the framework looks like. We expect that everyone will, I know this sounds outrageous, but it's 100%. You need to meet every single requirement. It's not a, you know, you pass or fail these things. We think everything contributes to the model, so everything is important. If you don't get 100%, what happens? We put you into a quality improvement cycle, Nina. So we will work with a service and say, okay, you're not quite at the 100%. Here's where you haven't met those requirements. This is what you need to do to meet them, and this is the time frame that we expect that it will take you to get there. And then we work in tandem with them to get them to that point where we are assured that the service they're delivering is safe, it's effective, and it's of the quality that their community deserves and that young people deserve to receive. So that basically is the model integrity framework in a very short snapshot, given the time we've got to talk about it. It's a 3-year cycle, and then in between, if there's any sort of, you know, clinical incidents that pop up or some other thing that, you know, comes to mind, then we work it very intensively with the service to make sure that the quality of the service they delivered is maintained and improved where possible.
Great, thanks, Kira. So sorry, Ivana, we're gonna move forward, but there will be a chance for some more questions in the next half hour or so. I want to just reorient all of us to be on the same page for what we'll do for the next, let's say, 25 minutes. There's basically 2 things that we want to accomplish in this 25 minutes. So one is to give a better sense of how Orygen can support what's happening in the region. This is to the second part of your question, Nina, like how we've done this with other countries in the past, and what sorts of things we have in store in order to provide that support. And then secondly, we want to hear a little bit more from you about specific challenges or contextual issues that young people are facing in your region, in your different countries and communities, because we're keenly aware that you can't just take one model that works in Australia and plop it anywhere else in the world because of those contextual differences. So I'm going to just talk for a second about the genesis of the framework and some of the other countries that we've worked with in the past. And Craig, maybe I'll turn to you to be sure that we're not missing anything in terms of things that are already established. For example, in Ireland, there's something called Jigsaw. In Denmark, there's Headspace Denmark. In Canada, they have something called Foundry and other sorts of youth mental health services. So those are all similar to the Headspace model that work in those contexts. So the question was, okay, so if this is working and useful in Australia, is it possible that it could be exported, for lack of a better word, to other places around the world, and how would it have to be tweaked if so? And the way that Orygen went about that was a couple of years ago, partnering with the World Economic Forum in Geneva to create this sort of global framework on youth mental health. And the thought was, okay, we have the experience in Australia, and the World Economic Forum has a really strong platform, including a network of young people around the world who are very interested in youth mental health. So let's use those two elements of expertise to really build out this framework. And so over the course of a year, we conducted a lot of interviews and workshops and focus groups, and we had a survey online with young people, with practitioners, academics, service providers and service users, people with lived experience, of course, all of them to kind of put into this input into this framework. And what we wanted was something that would be useful as a sort of starting place for people, but also wouldn't be so prescriptive that it would be restricting. And so what we came up with then was this global framework. And if you think about, in order to implement a model for youth mental health, you have the principles, and then you have practices that inform those principles, and then finally you have interventions that are going to make sense in the context that you live in. We wanted to stay away from the interventions piece because, one, that's context dependent, and two, there are normative organizations that create interventions like the World Health Organization. So we didn't want to compete with that. We wanted to sort of signpost to those interventions, but rather to stay on that, and particularly that principles level and some of the practices that say, what are the key things that need to go in to a youth mental health service? And so those are things like youth engagement and participation and peer supports, to the points, some of the questions we had before, integration with the health system, also to the question that we had before, early intervention and a focus on prevention, accessibility and affordability. These are things that are not, on the one hand, it's not rocket science. On the other hand, they're super, super important to do in a way that makes sense in that local context. And so what we've been doing, and what we hope to do with some of you, is working with community-based organizations and other partners to figure out what sorts of things how they would implement that framework in their context. And what we've learned so far is a lot of times this has to do as well, not just with services, but also advocacy, right? Getting the populations ready, securing the political will for trying something like this, education and stigma fighting and all of that stuff. So in addition to that framework with those principles, we also have an advocacy toolkit that helps to upskill people to actually do strategic advocacy for a targeted group, whether that's government stakeholders or other leaders or lay people, populations in general. So we have these different tools. We work very much in a customized way with each partner that we partner with, and we're happy to do that with you. We'll be sure that you'll have my email and Craig's email to follow up after this, but that's kind of the theory behind it. We're working with a number of different organizations around the world now, but maybe Craig, I'll turn to you to talk as well about the relationship between Orygen Global and Headspace, and then some of the other youth mental health services that exist around the world, like Jigsaw and Headspace Denmark.
Thanks for that, Peter. Yeah, look, just to quickly maybe give people a bit of a context. So in terms of the work that Peter was talking about that we undertook in partnership with the World Economic Forum, one of the things we did was look at, who else was delivering youth mental health programs out there, sort of, I guess, in a similar way to what we'd sort of established here in Australia. And there was roughly 15 countries that we came across, again, predominantly high resource, I guess, settings, like Canada, Ireland, Israel, Denmark, Netherlands, UK, but very patchy in the UK. And I think it's fair to say that they're all doing it in their own way in terms of, context, I think, is everything in terms of, I think there's fundamental principles that Peter was talking about that people have applied it in their countries and how they've done it. I think what was interesting in terms of, because I got to see a lot of these services in operation, some of them have applied it slightly differently. So Headspace in Denmark and also the program in the Netherlands, which is called At Ease, they've developed theirs on a volunteer base because they knew that they were never going to be able to get a sort of significant funding base from the government. And also government wanted to situate it outside of the health system. They said, we don't want to set up another health service that fundamentally won't necessarily meet the needs of young people. We actually want to do something quite different. So they set it up on very much, I guess, a civil society focus and utilising sort of volunteers to provide supports to young people. Now, obviously that means that, it's not a clinical mental health service in the traditional sense, but it's very much targeted at that sort of prevention, early intervention end. And, I think the Headspace Denmark model has gone from strength to strength. They're running at about 25 centres at the moment. And similarly, I think the model in the Netherlands, which started maybe 2 or 3 years ago, is in about 4 locations now. And they've, built an extensive volunteer network who provide these sort of, early intervention supports to young people. And they really probably only see young people maybe, 2 or 3 times. And then, if they need sort of more significant sort of clinical support, then the plan is to refer them on to sort of traditional mental health programs. So it is done in slightly different ways in different countries. Ireland is, has similar aspects of Headspace, but have done it, I guess in an Irish way as well, and have brought in a number of other community supports to look at what types of look at the most appropriate supports that are relevant to young people, again, in the community that they live in. So it's been done in different ways. And again, I think that's been, the genesis of the global framework, is really recognising that, each country will approach it differently, but there are some fundamental principles that, if you're looking to do youth mental health well, there's some, evidence that indicates these are some of the things that you should be looking to implement in the type of program that you're implementing in your country.
Yep. Thanks, Anne-Marie. Did you want to say something, or you're signing off?
We're just signing off. We didn't want to, sorry, we didn't want to cut in. So just thanks everyone. It's been really terrific to join the meeting tonight and present on Headspace. So wishing you all the best with the rest of the workshop this evening and future endeavours.
Thanks, Anne-Marie.
Thank you. Bye-bye.
Great. So all of that to say, this has been kind of transferred to different contexts, as Craig said, mostly in high income settings, but we did design the framework to be resource agnostic. So in any setting, these principles should be able to be applied, and we're definitely happy to work with you on if and how that would make sense in your context. And we do want to get a little bit more of a sense of those contexts. So Nina, I'm not sure if you had specific folks in mind who you thought maybe would be able to chat about that, or if people want to just kind of talk through some of the unique challenges to their country or to their region for the next 15 minutes or so.
Well, I think that one way of approaching this is if people want to volunteer about their issues in a specific country, but I think we could group them around different pieces. One piece is, developing sort of a service that is a standalone versus an integrated primary healthcare service. That seems to be a tension that is kind of, there's lack of, and I think Ruslan's question was trying to address that, but so that could be one set of issues. The second set of issues are around policies. There are some countries where there's particular policy level, let's say policy level disincentives for anybody to present for any mental health services in the region, because going to ask for any mental health service means you are ready to give up on, you enter into a registry form where you are then later on, you could potentially be denied a driving license or going to university or these kinds of things. So that depends a lot on the context. And but so there's both issues, and then there's issues of workforce capacity building issues. The fact that in many countries of the region, not everywhere, but many countries of the region, there is a dire need, or the level of training of these clinical psychologists is really, really low, and the level of access to those is low. So those are some of the issues that we could discuss. The structural issue of connecting this special service to a user-friendly, to a primary healthcare service. Second things are issues around policies and how you dealt with some of those. That might be more complex to address here. The third issue is this capacity and the lack of, one of the things we're seeing is that the level of training that's provided to psychologists is really very, very low quality. And maybe the last point that would be more on the demand side, I found it very interesting that you discussed the Headspace brand. So that means you went around to create a brand that is recognizable, that people want to go for, etc. So that aspect is not given enough attention in a lot of the programs that are there. So it's like, even in youth-friendly health services that have had a longer transition to be in place, there's a lot of people who say, oh, we've never heard of that, even though it's been in their city for 20 years. So these are sorts of things that we might want to address, but I give it over to any colleagues that would like to perhaps make any points on that. So maybe we could all go by region. Maybe we could start with the Western Balkans. If I know that there are some colleagues from Serbia and Bosnia, who are certainly online. I think I'm not sure about Croatia, but that's not Western Balkans, that's Eastern. But maybe start with Bosnia and Serbia and Macedonia, Montenegro, any of that group of countries. If any of the colleagues wants to make any points in this part. Tasha, we have your hand up.
Thank you very much. We were quite active from Serbia, having in mind that we are looking for ways to, let's say, develop different kind of interventions or activities regarding mental health here. I have one question which is also related to cooperation between sectors, and when we position mental health care within the primary healthcare or health system, we are kind of more oriented to this, let's say, treating mental health, not the mental well-being. Let's say, I hope you understand what I mean. There is a big difference, and there is importance to, let's say, make this mutual meaning and cooperation between sectors when we are talking about mental health, in order to secure inclusive approach and destigmatization in our approach. So we were wondering, this is maybe a rhetorical question, shall we, while we're building community interventions or the website for mental health, use topics as depression, disorder, condition, HDAD, autism, and so on. So there's a bit of a debate currently happening with our colleagues from different sections, how we would go with that, because we would like to avoid that using some of the mental health information on the website that we're aiming to develop. Young people might be prone to diagnose themselves or label themselves and maybe oversimplify terms or topics that they would or would not like to identify with. Thank you.
That's a very interesting question. I think that one of the things that there is a bit of a tension that we see in exactly what Stasha was saying, this focus on overall well-being, but that tends to stay at the level, at a very general level. And I remember, I think it was a comment from one of our youth advisory group on mental health. One of the comments they made is like, you know, you go on the internet and you get advice from, you know, oh, just get some exercise, and so all sorts of things are put into that mental health basket. Without any understanding that these are serious issues that in some cases may require much more intense intervention and referrals and so on. So that building that whole system from the kind of the well-being part, which tends to be much more comfortable and tends to deal with less complex issues, all the way to things like the bigger issues like Sasha was talking about, you know, the risk of branding, of self-diagnosis and things like that. So how have we dealt with some of those things?
Well, I was going to just quickly comment, and then I was also going to just introduce another colleague who I see on screen, Alison McRoberts, Alison's been running Headspace Centres for years and is worked between Orygen and Headspace. So I was going to see if Alison wanted to make a comment too. I know because she's been working in that space. But one of the things I would comment on is we actually undertook some focus groups with young people in Bosnia-Herzegovina, and we did it, they were young people sort of largely aged between sort of 15 and 21. And we did a couple of groups, a couple were in Banja Luka and then a couple were in more rural locations within Bosnia. And it was, you know, because it was obviously interesting to get a cultural understanding about how young people talked about mental health in that country. And they were sort of describing that, you know, it's not something that they would be able to talk to their parents about because their parents' generation just didn't understand it. And obviously for their parents, you know, they had been dealing with lots of conflict, you know, in the region during their time. So, you know, this was a generation of young people that had never, you know, they'd sort of were experiencing mental health issues, but didn't necessarily have the language to describe what they're feeling. And it's interesting the point you make, Stanislava, about, you know, the language, because they were sort of saying things like depression and that don't really resonate with us, but it's more like things like sadness. So they were sort of more describing their emotions that were things that resonated. And I think what they were saying about services is that, you know, services should be located in locations where they're, you know, easily accessible to young people. So whether that's in a youth centre or even providing services in schools. So that's some of what we picked up on, you know, through focus groups that we did with young people in that region.
And maybe, Alison, if you have anything to add before we go to the question from the teenager here.
Thank you, and it's really great to be here. And as I said, just hearing some of the questions. So as Craig said, I worked in one of the first Headspace Centres that Orygen started about 15 years ago, and I managed centres for about 13 or 14 years, and I've also worked at Headspace National. So I kind of have worked across both Orygen and Headspace, and without any doubt, Headspace has completely transformed youth mental health in Australia. I think about it's made seeking help for mental health accessible to so many young people. And so when we talk about the brand, it is such a well-recognised brand across the country. And I think it is something that Headspace has done very well. That green kind of logo is very well known in all of our communities. If anything, for us now, 15 years later, it's a little bit too well known, because this is where every young person will come. We've kind of built it, they do come. It is one of the things in the early days, and it continues now, the importance of language that we use. We're very careful about the way we, you know, describe, you know, seeking help for young people, and it's filters through everything we do in terms of all of the language. And that's been an important kind of strategy from Headspace. When there was other questions along the way about, say, you know, things about our staff. To be honest, we will generally have lots of new graduates, lots of young staff, and some of that's for a reason. We wanted to take an approach where we brought fresh young voices in, where that weren't kind of, well, that's not going to work because we've tried that. It was about creating something new and exciting, and new graduates are absolutely open to that, and similarly too, like in the Orygen Centres, it's about engaging and working with peer workers. All along, we've done that at the Orygen Centres, and it's one of the absolutely one of the successes of the program, along with the youth reference groups. That's kind of one of the cornerstones of every Headspace Centre. It's easily the most exciting program I've ever worked with, and the way we've been able to engage young people. And while we started with, young people with very mild concerns, things like I'm worried about exams or I'm feeling down, we now see young people across the entire spectrum and have been able to deliver incredible services to young people across the whole spectrum. Highly recommend it.
Thanks, Alison. Let's go to the Teenergizer first, and then Nadia.
Hello, everyone. Thank you so much for sharing this amazing experience. We are Teenergizer. We are NGO in Ukraine, so we are working in East Europe and Central Asia. And we have our online platform. So we are providing peer-to-peer consultation. So we have like 1,000 consultation per month, and also with us work 120 psychologists. These psychologists, there are people, so they are studying in the last years in university and try to help the peer-to-peer to young people. So, and we had yesterday a conversation with the First Lady of Ukraine. So she is very interesting to provide this peer-to-peer consultation in a government level. So in our question is maybe you have such experience how to improve and how to involve this peer-to-peer consultation in a government level, not only like in an NGO, but also to work with the cities, with the government, and etc. Thank you so much.
Craig, you're muted.
I was just going to say, I think, is that a question for Ella? not wanting to put you on the spot, Ella, but you're muted as well.
You're muted, Ella, yeah.
Sorry, is this working now?
Yep.
Yeah.
Sorry, do you mind repeating that question for me?
Yes, sure. So we have like online platform where our psychologist, they gives like peer-to-peer consultation. And yesterday we had a meeting with the First Lady of Ukraine. So she's like ambassador of youth. And she was very interesting about how to involve this peer-to-peer consultation in a government level. So we have a question, maybe do you faced with this like process, how to better to explain or how to do it, how to improve our peer-to-peer consultation in a government level, to work with the cities, with the schools, like not only like NGO or online consultation.
Yeah, so involving young people in sort of those higher governance levels in government. I think that's a really good question. It's quite a big question. I think it's probably quite hard to answer briefly in something like this, but I think it's really important. My first sort of, I guess, consideration and concern would be the young people's safety, because, depending on what they're talking about, especially if it's peer support and sharing perhaps their lived experiences, we definitely want to make sure that the priority is that they'll be safe and they won't face any repercussions for speaking out, particularly at that high level. So there are a few things that can be done there to support that. I'd be happy to connect with you offline if you wanted to talk about it further. But safety sort of, it's great that they're expressing interest in having young people at those higher levels. I think that's often the biggest battle, is actually advocating for that to happen. So that's really positive. And working with young people, I guess, to build up what that role would look like so it meets them where they're at. So what type of capacity they have to be involved, and what that role, I guess, just shaping what that role actually looks like in a way that suits them, in a way that they feel safe, in a way that they feel that they can contribute. But I'm more than happy to connect with you outside of this session. I hope that's.
Thank you so much. Thank you. We will. Thank you.
Thanks, Ella. Okay, so let's go to Nadia and Ivana, and we have only a couple minutes before we go into breakout. So let's try to keep our comments short, please.
Hi. I will try to be short, and sorry in advance for the extra noise which may come because my neighbors are in a continuous process of renovation. I'm from Belarus, and we are currently working on a mental health platform for adolescents, and I wanted to thank Nina for this call and for all of the colleagues joining, because it's indeed very useful to hear about the experience of other countries. And I also wanted to thank Nina for giving a very comprehensive overview of the problems that we are currently facing. And indeed, it is the problem with the low qualification of specialists and lack of trust from adolescents towards school psychologists, and also the issue of outreach and marketing of our platform. We don't know how to really make it as recognizable as Headspace is in Australia now. And we talked to our colleagues in Kazakhstan and Jenny platform, and they said and confirmed that indeed initially it was like the word of mouth which helped them make it recognizable. So we don't know how to actually promote it in Belarus to make it that popular among adolescents. Also, we are currently facing a problem with, I don't know if you're following the news, like there is a major crackdown on the NGOs, and we don't know whether to make this platform associated and be promoted with the government, because there is lack of trust with the government, and we don't know whether to make it related with the Ministry of Health or with the Ministry of Education, because now they are all ideologically biased, and young people are maybe not with that official part of the society now. So and I see that Orygen, I checked the website, and it was also, I think, in the presentation, that it is governmentally supported. So is it true that you get a major support from the government? And but you also see, I also saw that there is like fundraising through the website. So is it purely governmentally supported and thus 100% sustainable, or do you also rely on private fundraising or NGOs? Or I don't know if I made myself clear. Sorry.
No, it's a good question. Yeah, so Orygen is supported by the Australian government at both the state and the federal level, but that's not the only source of support. So there's also funding that comes in from philanthropy and foundations and grants and research funding that comes in. So it is kind of a diverse array of funding. I think one thing that's going to be really relevant is just the story of how Orygen even took off. Like it wasn't that the government supported Orygen from the beginning. Actually, there had to be a sort of proof of concept for why this is actually worth investing in. And so originally, at the very early days in the 90s, there was a private grant, a philanthropic grant that was given to Orygen to sort of prove that efficacy. And it was only after that, it was kind of a 5-year period where that money had come in. And after that 5-year period, they were able to show the outcomes and take the data from their own jurisdictions to the Australian government that said, if you continue to support this, then it will continue. So the government wasn't, let's say, on board, and the advocacy has happened for a long time, but they weren't on board financially until that first after that first kind of stage. And I think it's a good model. Like a lot of people talk about catalytic investment in youth mental health, and getting that philanthropic support for the first part of it can be really, really useful, especially in a situation like you're describing, where maybe the trust between young people and institutions isn't very strong. So if you have some opportunity to do an activity that is independent, then you can make your case more strongly after that.
Thank you.
So we have a couple more questions. We do have some breakouts to get into, so let's keep these very short. Ivana first, and then Oksana. Ivana, go ahead.
Hi, everyone. Thanks, Nina, for the opportunity and the team. It is absolutely fantastic discussion so far. I'm just interested in something sort of say quite specific, since Stanislava and Craig mentioned a couple of things that resonate with Montenegro pretty well. So on one hand, we do have lack of workforce, and we also have pressure from parents, even peers, and the whole narrative around mental health. And at the same time, as Stanislava said, we need to destigmatize the topic alongside creating services. So in all of this, I'm just interested, what is the major lesson in reducing dropout when you refer someone to the services? So, if we lack workforce, if we, have pressures from peers, once that a young person is in process, I'm just interested, how do you actually keep them engaged until they really access it? Thank you.
Craig, or maybe Alison, you want to take this one?
I was going to say, Alison, did you want to tackle that one?
It is often, it's certainly about having timely access. At the moment, we're facing in Headspace lots of long wait times, which means that young people are dropping out. So we try really hard to engage when that first phone call comes in. We prioritise and reach out really quickly to young people. We then have lots of kind of checking in points and lots of kind of other opportunities around what can we engage young people in very quickly. So often we're finding young people are often feeling lonely and, no longer seeing peers. And how do we then introduce other things at that very early stage of bringing young people together? So at the moment, because of COVID, it's harder, but we're doing lots of online kind of, social groups, lots of art groups. And it's about connecting young people and kind of being hopeful and positive. We then, with our clinicians, will be having lots of regular follow-up and quite assertive, so that we make it very clear with young people about this is the plan. We engage them and work with them around the plan. And then we have very clear kind of points around, checking back in and giving them kind of things to work on in those in-between times. But where we can at that very early stages of putting other things in, thinking about how do we get you back to school or back to work, and it's all the practical things that we can do that often will help young people anyway. We also obviously link to our digital programs, and we're doing very practical brief interventions around getting on top of your sleep, getting back into exercise. And we introduce our brief interventions very quickly. And then often young people say, hey, that was enough. I don't need, more other kind of therapy. That the brief activities helped me get on top of how I was feeling.
Great, thanks, Alison. So just a process point here. We're running a little bit behind, and getting into breakouts and introducing and coming back, I think, is just going to cause more confusion. So I think what we'll do, we'll take your question, Oksana, and then I'm just going to ask a couple people to talk about some of the topics in the breakouts in this full room. We certainly could stay here for a lot longer. I wish we were in person so we could have coffee together or lunch or something, but this is the way it is at the moment. So Oksana, over to you for your question.
Sorry, just a moment. Sorry. Yes. Okay. My name is Oksana Savenko, and I represent the Ukrainian website on adolescent health issues, Support Me. We will also conduct online consultations of mental health specialists, and now we have more than 830,000 site visitors. In Ukraine, it's now very important to work with pupils, with schools, with adolescents, precisely in connection with increasing in the number of adolescent suicides and another mental health problem. My short questions: how how we work with school networks or school community or teachers, and how you build your communications with adolescents, with school community.
I can jump in with this one. We work very closely. Schools are key. Schools are so important in this piece of work about building strong, good relationships. We would do a lot of things together. We don't have enough staff at Headspace Centres to do on our own. So we team up with schools to say, let's do this together. They get to know that we're from Headspace, but we build strong relationships with the school. We would bring our young people, our peer workers into school and talk to students about, you know, how do you know, when do you know that things aren't okay, and how do you help your friend? So we deliver sessions to every young person in the school. We would then do groups in school, and we would often have one of our staff spend like a day or 2 days a week at a school doing sessions, and one of our medical doctors would be at a school. We would often, because we have a lot of schools, we would choose 4 to 5 schools and do things very well and evaluate it and think about what was that group program like that we delivered? Did we see what were the outcomes? A lot of it was around helping students manage, say, stress with exams. So very simple things, but that we would be working with the school staff all of the time.
Your presentation, invitation for school, or you work with your Ministry of Education, and how did you connect this relation with school community?
Many hours of meetings, hard work. It was, they had to start to trust us that we were going to do what we said we were going to do. We had to prove ourselves. We also, one of the important things is we did it alongside our young people and young people from the school. So we developed leaders in the school who would work with us, who would help us deliver to the students. And that was how we got over the line. And we did fun things. We ran, music groups and contests and had, food festivals, but it was a lot of hours of work, but very important. And some of the best work we did, particularly because we did in partnership. We can't do this on our own. And we built up very good relationships.
Many thanks for your answer. Many thanks.
Thanks, Oksana, and thanks, Alison. Certainly the focus on partnerships makes tons of sense, and also the youth engagement piece, which you touched on too. That was one of the topics of the breakouts, and I'm going to turn now to Ella Gao, my colleague, leads our youth engagement at Orygen Global, to just talk through a little bit the why, of why that's important, and then also the how. How do we go about actually engaging young people and not doing it just in a tokenistic way? And then after we hear about that, there's been a few people who've chatted about the role of digital and technology and youth mental health and how that is integrated into in-person care. And another colleague of mine, Jen Nicholas. Jen, thanks for being on the call with us today. I'm going to turn to you after Ella's finished. Ella, over to you.
Thanks, Peter. I think it sounds like everyone I don't need to preach too much. I think everyone understands the importance of having youth engagement embedded in your service development and your programs. But essentially, we know that young people are key in determining the types of supports and services that are relevant for their specific circumstances today. The young people of today are different to the young people of 5 years ago. It's changing all the time. So it's crucial that we're talking to those voices and having them meaningfully involved in the development of these programs to make sure that they're actually relevant for what they need. They're experts by experience, and they have a right to be involved in the decision-making of the programs and services that directly impact them. And we know that by doing this, it leads to better health outcomes for not only the young people, but adults, agencies, the broader community. It's a win for everyone. And we have seen globally that there's a huge rise in the number of young people becoming advocates for mental health, particularly in the COVID times. I think there's been a level of more acceptance with speaking more openly about it. So I think in terms of reaching out to young people, I think you'd possibly be surprised with how many are very much willing and passionate to be involved, particularly if they're not satisfied with the supports in place at the moment. And I guess in terms of like some considerations with doing that, I think it's really important that you do reach out to young people from the very start. So the earlier that you can involve young people in those conversations, the better. It's really good to have them involved in even those early conceptual meetings about what a program or a service might look like, and engaging them throughout that whole journey and making sure that they do have a meaningful voice in that. But also making sure that you do have early on some really honest discussions about how things will work, and being prepared to actually listen to what they might say. I think sometimes it can be unexpected, and a willingness to actually take on board what the young people are telling you is really crucial. And agreeing, having a sort of shared understanding and taking that time to really agree on the elements like the purpose, the goals, the objectives of what you're working together towards. I know that this can be difficult depending on the context. I'm very aware that we have many different countries dialing in today, but certainly from an Australian point of view and in all of our global work, compensation is really important. We would pay any other expert for their time, and therefore it's just as important to make sure that young people are being compensated for their expertise. So what that looks like, I know, will vary from place to place. Certainly as a bare minimum, as I said in the chat before, I think food is a great way to attract young people. So if you are going to schools, if you're having them in meetings, try to put on a bit of a spread. It's amazing how it will also break down some barriers. Sharing food is quite it's an experience, I guess, and it does break down some barriers with getting discussion flowing. But I guess more broadly as well, ensuring that decision-making power, young people are embedded ideally in your governance structures. So for example, within the Orygen Global team, we have young people, both within our project team. When we were starting out, we had some youth advisors who were involved in every meeting and all of the decision-making, also in some consultations that we did globally. And now we've actually got a couple of those youth advisors who designed their own program in that process. Essentially, they're the co-founders of that program. They're now running it. So they've seen it go from the very start, that conception phase, right now through to the delivering and the implementation of it. Some of the issues I think that do need to be considered, though, particularly in a COVID time where you might not be engaging young people in person, but rather online, is thinking about some of those more thorny issues like internet access, language barriers, how to be truly inclusive, acknowledging that young people are not just one big homogenous group, even from country to country, speaking to 10 people from Australia is not representative of Australia. So really thinking about who you're hearing from and who you're not hearing from. And really giving thought to specific groups of young people, people who are from LGBTQI communities, different racial and ethnic groups. There's a lot of considerations, and it's really important to be really mindful of that when you are thinking of young people. I'm just having a look at the chat, sorry. Alison, yeah, thank you for sharing that. That's a really good point. How do you go about selecting the young people that you work with to make sure that they're representative? So in the instance of Orygen Global, we have a youth advisory council at an international level, and we also have a group of fellows. In both of those groups, we had an expression of interest process where a young person could apply for those positions. And in that, we asked a series of questions that were sort of, they gave us an indication of some diversity indicators, things like their age, if they had mental health experience either themselves or with their family with ill health, their racial and contextual, like which country they're from, a whole range of different questions to really map out different diversity indicators. And then hard work, really going through and actually making sure that when it got to the interview process, that it wasn't just a targeted group of one subset of young people, but we really had a number of experiences reflected in the young people that made it through to that next stage. I don't think there's an easy answer, and I don't think you'll ever get a truly representative group, but those questions can certainly help. I hope that that helps. Peter, is there anything else you wanted me to cover?
Oh, that's great. I was just going to point you to the chat, but you've done a great job of fielding those as well. So thank you, Ella, for that. And just to reiterate what you heard at the top of the call with the Headspace folks too, and their presentation, young people are key, they're foundational to everything that happens. This doesn't matter if young people aren't involved. We actually had an interesting conversation recently with someone who wanted to put together a conference for young people on youth mental health and hadn't even considered involving youth in designing the conference. And we were like, okay, well,
that was an interesting conversation.
Yeah. So I think philosophically we're all on the same page there. Okay, thanks, Ella. We're going to turn now to this question of digital technology and the integration of digital with in-person. Jen, thank you for being so patient here as we're coming to the end of the session. But over to you to just give a little bit of a primer on what you're doing, who you are, and how that question of complementing digital with in-person works.
Yeah, no problem, and no thanks necessary. It's been a really interesting conversation to be listening to. So, and I think, you know, one of the things to, you know, sort of springboarding off what Ella's been saying, you know, I think that importance of youth consultation and youth involvement within conception, development and implementation really does also extend to digital platforms and digital ways in which we can engage young people. And as we sort of go forward, we're really looking at, as Peter's spoken about, of how we can integrate digital platforms within, quite frankly, a range of contexts. So I know there's been a lot of discussion here about schools and how we can catch sort of young people where they are. And then obviously one of those other important contexts in which to start to marry the sort of possibilities and great strengths in terms of reach and accessibility of technology is to start to think about how we can integrate them into our existing digital, our existing health service structure. And that's what we've been doing. So my role at Orygen is as a researcher working in digital mental health. And we have a digital platform which has been developed over 10 years, beginning with youth consultation, called MOST, Moderated Online Social Therapy. This is a platform that kind of has sort of really three main components. It has therapeutic content, so sort of you may be familiar with sort of more module-based therapy around different mental health conditions. There's a social component, so a social network where young people can connect with each other, learn from their shared experiences, and do that in a sort of safe, moderated environment. And then there's a service component where we have both clinicians, but also peer workers and vocational peer workers that can also support the young people on the platform. So this is a digital platform that at the moment is being integrated within the Headspace services throughout our state in Victoria. And it's really about how we can use this digital platform to really support what's going on within those Headspace and those youth mental health services. So we're really thinking about this in terms of how it can, digital technologies can support each stage of care. So for example, there are young people who, because of the unfortunately high demand for mental health services, oftentimes there may be wait lists at Headspaces. So it's about how a digital technology can support and provide treatment, psychoeducation and connection for young people as they wait for care, as they move into accessing that face-to-face service, how the clinicians within those services can use the resources on MOST and on that digital platform to really enhance the work that they're doing within session and point those young people to be practicing skills and using and learning in between the sessions that they're having with their face-to-face clinicians. And then as their sort of period of treatment comes to an end, the digital platforms can really start to work in a either relapse prevention or more ongoing lighter touch support post contact with face-to-face services. So it's really thinking about what the strengths of technology are and where the where that can support the brilliant on the ground work that our clinicians are doing within the youth mental health services across the country.
Thanks, Jen. Really appreciate that overview, and Craig has just put the link in the chat to more description on the MOST model from Orygen. I think just to underscore this point that we can't make assumptions about preferences in digital because the people's opinions are just very divided. I mean, I think it's clear that the advantage of technology to increase accessibility is there, but we all had this hypothesis that young people would want to use technology as much or more than sort of in-person visitation, and that was refuted when we spoke with young people around the globe. Go ahead, Jen.
Yeah, I think this is a really good point because I think, you know, there's often a perception that we think about technology as a sort of solution to all the problems, and I think what's really useful to keep in mind is how technology can support the services that already exist and how technology can potentially offer different options. Essentially, we're adding another tool to our bag. And that's, I think, really what we have to think, because as you're saying, Peter, like not everyone is going to want that type of support, but for some people, that type of support might be an entry point into more face-to-face care. I mean, you know, when we're thinking about, we're talking to Headspace users around their preferences for mental health delivery, we're speaking to a unique set of young people who have made a decision to front up to face-to-face support. So those people, for a range of reasons, then might actually, you know, that's what they wanted, that's why they're at Headspace. So it's about being able to provide other options for potentially the people who may not have made that leap, aren't ready to make that leap, or in countries where it's unfortunately still heavily stigmatized or has sort of knock-on repercussions potentially in terms of a whole range of aspects in their lives. It's a sort of anonymous way to get the support they need and potentially put them on a sort of pathway to receiving sort of different types of care in the future.
Indeed. Thank you so much, Jen. Thank you all again for your participation and your willingness to join up with us here today. We're pretty much at time, but I wanted to turn to you, Nina, and you, Craig, to see if you have any other final points. I'm going to re-put our emails in the chat too, so we can follow up with this.
Well, from my perspective, I think that this has been very useful. I think it's been very useful to hear from those people who've been working around this and breaking their brains around how to do it and how to make it all work for the last 15 plus years. It was useful to hear not only about what it is now, but how you got there. And the fact that it didn't start with because everybody gets immediately hooked on the issue. Oh, your government is supporting you. Yeah, but it took a long time to prove the concept, as Alison was saying, before you could get there. So I think it's important for us to understand these different stages. What I also think is very useful is, to the extent possible, I mean, this is exactly the sort of detail that one doesn't get in a guidance document or in a general framework document, which is, okay, what does it take to make this happen? How do you build that trust? What are the elements, you know, like Ellie just shared about the process of recruiting the kids into young people into the process. How does that really look like step by step? So these are some of the things, some of the tools and practical approaches where we really count on you, on your team, to help us in making sure some of these are actually perhaps replicated and so on. And we should probably work on a country by country basis. I apologize for all those who wanted to maybe speak and didn't have a chance from other regions, the Caucasus and Central Asia. But there is a number of initiatives in which we could really either benefit from Orygen and Headspace to tweak what we're already doing, or completely change what we're already doing. And so in a sense, I look forward to further discussion, further exactly help, hands-on practical help. That's what really is most needed. Really things that can be replicated, used, adapted, etc. How do you go about the different bits and pieces? And I know that there's a lot of our colleagues who have questions, and so we should probably have a system for maybe have a subgroup discussion with countries that are really advanced in trying to either do the digital mental health component or who are trying to set up a service. But right now, these days, everything is a hybrid. There is no just face-to-face system anymore. It's a mixed system. So I think that there's a lot to be learned from that, and where we really appreciate your time today, your willingness to share really open and interesting information with all of us. So I only have to say thank you to all the great work and to for your time, especially given the time difference with Australia, and it's late at night over there. So real thanks to all on behalf of all of UNICEF colleagues. So over to you, Craig.
Thanks, Nina, and thanks everyone from Orygen who's contributed to the discussion today, but also all the participants from the different countries who've come with lots of questions about, I guess some of the work that you're looking or currently undertaking in your country. What I would say going forward is I think, one of the things we can do, because obviously this was a fairly broad-based discussion this evening, and it may raise more questions than it answers, but I think what it does do then is give us potentially an opportunity, if you want to have a deeper dive into a particular area, like whether it's around digital mental health or youth engagement or, setting up a Headspace Centre or a Headspace equivalent, we can actually go down that path, and we can potentially set up specific, conversations, in those directions if people would like that. But certainly, we'll be connecting again with Nina and Ruslan, evaluating some of what's come out of this evening, and, looking at sort of next steps and whatever we can do from an Orygen standpoint in being able to help you establish youth mental health programs in your country. We certainly look forward to those opportunities and potentially working with you going forward. So again, thanks everyone for your participation this evening. I really appreciate it. And I'll hand back to Peter, and thank you, Pin, for putting up our contact details.
And there you have it. You have the generic email address, and then the three of us, Craig, Ella, and myself, to follow up. We have been recording this, so the recording will be made available, and some documentation that we linked to, etc., can be circulated afterwards. But in the meantime, yes, thanks again. Have a lovely day. We look forward to hearing from you, and we'll be in touch in the future.
Thank you all. Thanks so much. Very useful. Thanks a million. All the best.
Thank you so much. Thank you so much. Very useful. Bye-bye.
Thanks.
Thank you.